Neil, I have a problem with the ECGs. Can you help me?
Sure, if I can. What's up, Teresa?
Dr. Sutton wants me to call him whenever a patient has a heart rate that's too slow or too fast. How can I tell the heart rate without a ruler and a calculator?
Heart rate is easy to eyeball. Let me show you how. Do you remember what the normal heart rate of an adult is?
60 to 100 beats per minute is normal.
Correct. So, if your patient's heart rate is faster than 100 or slower than 60, then call Dr. Sutton. Let's look at the background grid on Mr. Epstein's ECG. Let's count the R waves. Do you remember from class? The R waves are any upward peak. R means one heartbeat. Counting R waves on the rhythm strip will let us calculate the rate without a ruler and a calculator. Lead 2 is the best. Each large square on the grid measures 5 millimeters. It represents 1/20th of a second, or 200 milliseconds. Each large square contains 25 little squares. Don't concern yourself with the little squares. First, find an R wave that peaks on a thick line of the ECG grid. That is our start line. Ignore the thin lines. We only name the heavy lines that follow our start line. There are just 6 numbers you need to memorize: 300, 150, 100, 75, 60, and 50. Count off the number of thick lines between the two R waves. The first thick line on the grid after the R wave is called 300. The second thick line is 150, the third is 100, and the fourth is 75. Mr. Epstein's heart is beating about 75 beats per minute because there are 4 big squares between his R waves. Teresa, would you call Dr. Sutton about Mr. Epstein's heart rate?
No, Neil. 75 beats per minute is in the normal range.
Exactly. Now, memorize the 6 numbers and you can tell any approximate heart rate immediately just by counting large squares between the R waves. Repeat after me: 300, 150, 100, 75, 60, 50.
300, 150, 100, 75, 60, 50.
That's right. Now, let's practice on this next ECG.
Wait, Neil, does it have to be a normal heart? Will counting squares work if the patient is very sick?
Yes, this method always works. Here is an ECG for Mrs. McCready. She has bradycardia. What does that mean?
Her heart rate is too slow.
That's correct. Now, find an R wave starting on a thick line and name the squares.
300, 150, 100, 75, 60, 50. Oh, too slow. Mrs. McCready has less than 50 beats per minute. I would call Dr. Sutton for her. Do I have to know exactly how many beats per minute?
An approximation is fine. You don't need to be exact. This advanced machine from the intensive care unit prints the rate in the top right of the ECG strip for the critical patients. See? 43 beats per minute on average. But Mrs. McCready's heart rate has gone as low as 39 beats per minute. None of our other ECGs calculate the rate automatically. Those patients are not critical. That's why Dr. Sutton wants you to do it. A ballpark figure is good enough.
One more, please, Neil. Do you have a patient whose heart is too fast?
Yes, here's a patient with tachycardia. Can you figure out how fast his heart is beating?
Wow, less than 2 big squares between his R waves. That means his heart is beating faster than 150 beats per minute. I would call Dr. Sutton right away.
I think you've got the hang of calculating a heart rate by counting the large squares between the R waves, Teresa. Remember, during an emergency, you would probably not be able to find a calculator and a ruler, but your brain is always with you. Before I give you two more ECGs for practice, can you repeat the names of those 6 squares?
300, 150, 100, 75, 60, 50. Call Dr. Sutton if the R waves are less than 3 squares apart or more than 5.
Right. Now, rarely you will get a very fit young athlete with a slow, efficient heart, like this one. He is healthy. Let Dr. Sutton make the diagnosis.
Oh, thanks for your help, Neil. I'll practice some more.
No problem, Teresa. Anytime.